Welcome back to Hey Kentucky. I am pleased to be joined today by Rachel Smith. She's the executive director of the Refuge Clinic in Lexington and in Jessamine County as well. Rachel, thanks for being here.
It is my pleasure. Thank you so much for having me.
First of all, I kind of want to get to know a little bit about the Refuge Clinic. So tell me about your mission.
Absolutely. So, the Refuge Clinic is a nonprofit organization, and we provide free medical, dental, and behavioral health services to those that are uninsured or underinsured and often find themselves having problems with access to care. And we do that through hundreds of volunteers. So, all our providers, our doctors, our dentists, our psychiatrists, nurses, all are volunteering their services.
Now, you said uninsured and underinsured. Of course, in the state of Kentucky, we've had unemployment rates truly like no other state in the U.S. has seen through this pandemic. So people may not have insurance or certainly may be underinsured at a much higher rate now. Are you seeing your numbers spike?
I believe that we've consistently seen our numbers go up. We've been around for 11 years, and so I know there's been some transition through different things, even with the Affordable Health Care Act. I think that we've watched numbers kind of ebb and flow, but quite frankly, yes. I mean, the numbers continue to show that people do have difficulty finding access to care. Sometimes even with Medicaid, you find yourself having limited access whenever you need it. And so we're just here to be able to provide that care for, again, a variety of services for people that would need medical, dental, or behavioral health services.
What have been your biggest challenges during this pandemic?
That's a great question. We love being relational. In fact, we talk about relational healthcare. I think that's really important to what we do. And so, as you can imagine, with the pandemic, being respectful and creating isolation and doing things that are appropriate to make sure we keep things at bay, it's tricky to keep that relational component. And we've introduced telehealth, which is imperative to what we're doing. But I also find that because the relationships are so genuine, it doesn't matter that we have to connect through a computer. We can still really be able to connect with our patients, express concern and care, and get them connected to the things that they need. So that's probably a challenge, but I don't think it has been a detriment in any way.
As far as people who may be going through some underinsured times or uninsured times right now, how do they contact you? How do they get access to this medical care?
We love getting phone calls. So you can call us at 225-4325 and schedule an appointment. Because we operate with volunteers, we request people to set up an appointment prior to just walking in. We do accept walk-ins whenever it's, sometimes necessary, but we just ask people to call, schedule an appointment. We work through kind of what the need is and figure out a way to get you scheduled in a timely manner. So if someone finds themselves needing dental care or primary care, just making that phone call and we will do our best to connect you and get you scheduled as soon as possible.
And are you all doing any coronavirus testing or antibody testing right now?
We're not doing testing right now. We found that it's really great to partner with others that are doing that in the community. Quite frankly, we see the need to continue really staying focused on the primary care component of it. I think we recognize there's huge health inequities that we're seeing with coronavirus as well. And so, the population that we are able to partner with and to serve, we serve those that are high risk. And so we want to be able to continue to really provide a source of primary care so that, patients can be set up for success and not necessarily have to struggle with kind of knowing where the next visit comes from or, the care that they need.
You mentioned it, but certainly the coronavirus has exposed a lot of things about inequities in our society, and healthcare is certainly one of them. What is sort of the feeling that you, the providers you work with, what feeling do you get from doing this, from being able to genuinely help people that need it?
It is genuinely an honor. Honestly, our patients are my friends, and I think that I think our patients and our doctors would say the same. I think that there is so much joy that comes in utilizing healthcare as an opportunity to really connect and to build each other up. And I think that the lives not only of our patients, but our volunteers and our staff are all affected by being humble and serving each other and saying, hey, we believe everyone has the right to be able to get the health care that they need. And so we're in this together so that we can build up, families in the community and celebrate instead of kind of see the downfall of things that happen whenever those systems break down for those that are often overlooked.
Rachel Smith, thank you for all you do. Thank you for letting us know more about the Refuge Clinic. We appreciate it so much.
Well, thank you. I appreciate it as well.
All right, much more Hey Kentucky right after this.